This is Dr. Clay Brooks with Real Medicine. The question today is, why does BMI matter in surgery? A lot of people will say BMI doesn't matter, weight doesn't matter, and today we're going to talk about it. I've been in and around medicine for over 30 years. I've been in surgical practice for just over 20 years at this particular point, and I think it's important that we get to the truth when it comes to BMI and weight. Now, I understand that weight can be a very sensitive topic, but we need to deal with the facts and how these facts affect your health and not so much the emotion that's associated with it. And even though weight is a sensitive topic, it is a very, very important topic, especially when it comes to your health and especially when it comes to surgery. People that tell you weight and BMI don't matter are not being honest with you. What health metrics does your weight affect? So, not only does weight affect health metrics like blood pressure, blood sugar, risk of cancer, overall mortality, your weight is very important when it comes to surgery. What are surgical implications? Weight has general health implications, but outcomes in surgical intervention can be affected as well. And that's why we're going to focus on this particular topic in this particular video. The healthier and stronger that you are going into surgery increases the chances that you will have a better recovery coming out of surgery. So, what is BMI? BMI stands for Body Mass Index. Memorizing the formula is not as important as the potential health implications when you have a high BMI. But the formula for BMI or body mass index is weight in kilograms divided by height in meters squared. There is an online BMI calculator at cdc.gov. I'll put that link in the description. That way you can calculate your own BMI. The calculator will ask you for your height in feet and inches. It will also ask for your weight in pounds. You click a button, it will calculate the BMI for you. Here is an example of an adult BMI chart. There's categories on one side, BMI range on the other side. So starting with underweight, you're considered to be underweight if the BMI is less than 18.5. You're considered to be a healthy weight if your BMI is 18.5 up to 24.9. You are overweight if your BMI is greater than 25 up to 29.9. And obesity starts with a BMI of greater than 30. Now, there are obesity subclasses. You have class 1 obesity, class 2 obesity, class 3 obesity, which is also known as morbid obesity. And we'll go over the different ranges associated with those categories or classes of obesity. Class 1 obesity is when the BMI range is 30 to 34.9. Class 2 obesity is when the BMI is 35 to 39.9. Class 3 obesity, also known as morbid obesity, is when the BMI range is greater than 40. Now, again, morbid obesity equals class 3 obesity. Morbid obesity is classified when the BMI is greater than 40. When we speak of the term morbid, we think about disease. Remember, mortality equals death. Morbid means disease. And what that means is morbidity means that there will be multiple potential associated diseases when you have class 3 obesity. When it comes to insurance companies and BMI, many of the commercial carriers are starting to deny claims for outpatient surgery when the BMI is greater than 40. Now, I have to admit, I'm not always the biggest fan of many of the policies associated with healthcare, but this one I can't argue with very much because the higher the BMI, higher the complication rate. If you have high complication rate, there's potential for more reoperations. Potential for more reoperations tends to go along with higher costs. So on this one, the insurance companies are being very strict when it comes to BMI and outpatient surgery. So if you're considering having outpatient surgery, bear that in mind that many of the commercial carriers will be very strict when it comes to your BMI. Now, I'll be the first to admit that medicine is not an absolute discipline. When I think about medicine, medicine is a combination of science plus art. BMI is not perfect, nor is it absolute. That does not mean it's not important. BMI is very important. Let me ask you a question. Does smoking cause cancer? You know the answer to that question. Does everyone that smokes get cancer? No. Does that mean you should start smoking? No. Does everyone with a high BMI have high blood sugar and diabetes? No, not yet. Should you ignore BMI? No, you should not ignore BMI. This is Aaron Donald. He is a Super Bowl champion. He is a 3-time Defensive Player of the Year. He is a Defensive NFL Rookie of the Year. He is 8-time first team All Pro. He is a 10-time Pro Bowl player in the NFL. This is a bad man. During his playing days, he was listed as 6'1", 280 pounds. Based on that, his BMI would be listed as 36.9. Based on the BMI calculator, he would be classified as class 2 obesity. Why? Because muscle weighs more than fat. I would not tell this man to lose weight before surgery if he needed my services. This is an example of why the BMI calculator is not perfect, but it still should not be ignored. So many will use this as an example, though, to discredit the BMI chart. They'll say, see, this man is classified as class 2 obesity. Look at this man. He's a perfect specimen. Yes, he is. And there is not significant evidence of obesity in the pictures that I showed you. But before you tear down the BMI concept, I would recommend you do a very, very simple test, but it requires honesty. Have a long look in the mirror after you get out of the shower before you tear down the BMI calculator. We have to be honest with ourselves if we're going to live quality, healthy lives going forward. Yes, muscle does weigh more than fat, but most of us do not look like Aaron Donald when we get out of the shower. That's the reality. So, what about high BMI and surgery? So, in orthopedics and spine surgery, increased BMI can be associated with increased complications. It can be associated with higher reoperation rates, and it can be associated with lower patient satisfaction. And that's the point of elective surgery, is so that the patient has a better quality of life, is able to get back to the things that are important to them and the things that they enjoy. Also, higher BMI can be associated with comorbidities. Again, what is a comorbidity? Remember, morbid equals disease. Why? Well, in general, if the BMI is higher, then there's a higher likelihood of other diseases like heart disease, diabetes, vascular disease, and many other things. Sometimes we use the term disease burden, meaning the more comorbidities or the more diseases you have, there's a higher disease burden. And your body has to combat all of those factors in addition to recovering and healing from a surgery, which can affect your outcome. So when we think about disease burden, it means the more things we have to deal with as surgeons has a potential to affect your outcome. You may come in to see me with a painful neck, painful mid back or lower back. After workup, evaluation, testing, we may identify that you have a herniated disc. That is bad enough. But now you add a herniated disc plus diabetes, plus heart disease, plus poor circulation, and all those things can affect your outcome. So, is BMI important? Yes. Is BMI perfect? No. But BMI does not have to be perfect. Context in medicine matters. Those who tell you that BMI is not important, they overlook context. High BMI is associated with comorbidities. High BMI is associated with poor surgical outcomes. High BMI is associated with higher complication rates. That is the context of BMI in surgery. This is Dr. Claybrooks with Real Medicine. Thank you so much for watching. Please leave your comments below. Please share this. Please like. Please subscribe. Bye bye.